This is Eye on Health on Dubai Eye 103.8
with MedLab Middle East.
I'm Helen Farmer with you on Dubai Eye 103.8. It is Eye on Health, brought to you by MedLab Middle East and Arab Health, and we are talking kidney care. A topic very close to my heart, I have to say. I'm joined now by Dr. Krishnam, Raji, a nephrologist at Prime Health. I'm so grateful for your time today. Thank you. I want to get a bit of an understanding about what your job entails. And then we're going to be talking about the future of diagnostics and indeed treatments. Why were you drawn to this area of medicine? And what does a nephrologist, if I'm saying it right, actually do, Dr. Krishnam?
Yeah, so I'm Dr. Krishnam Raju. I'm consultant nephrologist at Prime Hospital, Dubai. So nephrology is the branch of medicine which deals with the well-being of the kidneys. And kidneys are kind of a silent guardian of our body, and they take care of not only cleaning the waste in the form of urine, but also do other functions like regulating the level of blood you have in your body, the blood pressure, most importantly, and also bone health. So it's kind of a crucial and silent guardian, and I'm interested in its well-being as well.
It's funny, it's something we shouldn't take for granted, but something we probably don't really think enough about. I know you do all the time because you have people in pain and distress and wanting to proactively look after their kidneys every day. But for someone who is focused on kidney health, what kind of new developments are you excited about when it comes to, let's start with diagnosing, if you don't mind.
So coming to the diagnosis of kidney disease, one of the difficult parts of being a kidney specialist is that there are absolutely or there could be absolutely no symptoms when your kidney function is going wrong. That's why most of the times kidney diseases are picked up on a routine test or it's usually a surprise for the patient because you don't have a pain or a very obvious symptoms which will point towards kidney disease. And the conventional way of diagnosis is by a test called serum creatinine and a urine protein test. So when your serum creatinine, it is like the waste level of your body. If it is starting to go up, so it means that something is wrong with your kidneys. And another thing is if your kidneys are leaking protein, which is seen in the urine test, it means there's something wrong. Unfortunately, these also can be like a late marker. So we are looking at newer diagnostic methods so as to see if we can pick them up early. And one of the newer modalities for diagnosis we are having is called a CFE MRI, which is a cationized ferritin enhanced MRI.
Oh, so slow down. What does that mean? And what does it look like? And what's it looking for?
Yeah, so to break it down in simple terms, in the kidney, we have small filters called nephrons. These are the functional units of the kidney, and these are the guys which do all the heavy work, like cleaning the waste from our body. So once a nephron is damaged, it will not be regenerated ever in your life. So it's very important to protect any factor which is causing harm to the nephron. So what happens is the rest of the nephrons, they do the work of the damaged nephron. And eventually what happens is if the nephrons are damaged to a significant effect, the other nephrons also burn out. So this is the way kidney disease progresses.
How many nephrons do we have?
So in each kidney, there are 1 million nephrons. So there are 2 million nephrons in total. And these will remain constant throughout your life. No new nephrons will be formed.
So you've got to look after them. It's a bit like eggs in the ovary. You're born with a certain amount. You're not going to make any more, so you need to look after them. And as you're saying, if they are damaged, then you have the other ones compensating, and then they get fatigued, and then so it goes on. Why might a nephron get damaged? What can put it at risk?
So the most common in current day is diabetes. So diabetes kind of scars these nephrons. Other diseases called glomerulonephritis, which is specifically affects these filters of the nephrons. So these are common diseases. Otherwise, there could be kidney stones, there could be hypertension, and so on and so forth.
I had a lot of urine tests during pregnancy, and it was always about proteins. And I think was that looking for hypertension in pregnant women? That was that a concern?
Exactly. As I mentioned, one of the reasons we do a whole body evaluation is when you're pregnant, and some of the kidney diseases get detected during this pregnancy. So that is one of the areas when we can find out if there's something wrong.
Dr. Krishnam, coming back to detection and diagnosis, I know there's been something I'd love you to explore a little bit more, which is about the scarring of the kidneys. Why might that occur?
So, as the nephrons which are compensating for the already dead nephrons, you would say, these kind of do a hyperfiltration. So the load on the individual nephron may be so high, and they eventually burn out. So there are certain cellular level changes which happen in the kidney, and that will cause the scarring.
Okay.
A factor called TGF beta specifically.
There's something on my notes that I need you to explain. It's called cell-free DNA. Without getting too technical about it, Dr. Krishnam, can you explain what we as the general public need to know about when it comes to kidney care and indeed whether it is cancers, transplants, and so on?
Yeah, cell-free DNA is an aspect which is more important in diagnosing cancers. There are certain cancers which are common in the kidney called renal cell carcinoma. So the way we can put it is all tissues, all cells, they go a natural process of being born and die. So when they die, they release certain DNA from their cells. This is called a DNA. So when a cell dies, the free DNA circulates for some time in the blood. This is called a cell-free DNA. Suppose there is a tumor. So these tumor cells also go a process of death, and then the tumor DNA also circulates in the blood. So this is called a ctDNA. This is called a circulating tumor DNA. With some technologies, we are trying to identify these DNAs and kind of home into the tumor which may be causing them, so as to detect an early process of diagnosis. Because conventionally we have to find the tissue and do a biopsy, which is like taking a piece of the tissue either surgically or by invasively. So by this technique we can like try to diagnose a marker of the tumor and identify it early.
What are your hopes for the future when it comes to kidney care and indeed treatment? What kind of conversations would you hope to be having in this space as a nephrologist in 5 or even 10 years' time, Doctor?
Actually, this is very exciting time in the field of therapeutics for nephrology, because so many therapies which were not available, say 10 years back to the previous generation of kidney disease patients are available. So, for example, we are now the best possible transplant for a failed kidney. The best possible treatment, rather, for a failed kidney is a transplant. And we have severe organ shortage for transplant. So we are already in the process of identifying a process called xenotransplantation, that is giving a kidney from an animal to a human. So this is already ongoing. So it's already done. So we have identified that kidney from a pig can be successfully transplanted to a human. So this is to overcome the shortage of organs and improve the quality of life of the patient. So this is in very nascent stage, and obviously there are new questions and new frontiers to be broken. So this is one of the important aspects. We're also looking at an artificial kidney, which is like a mechanical organ which tries to replicate the function of the kidney. So again, these are all under clinical trials, and probably and hopefully they will overcome the barriers we are facing and to offer a better quality of life to our patients.
And lastly, for everyone listening today, and obviously if there are any specific issues or family history, let's put those aside. For the general population, any advice that you would give as a nephrologist to help us keep our kidneys in the best possible health? What do you wish that everyone listening today would do, try, or indeed avoid?
Yeah, so for all the general public there, so get your annual health checkups when you are over 40, especially if you have risk factors like diabetes or a family history of any organ damage in your family. So just get it checked because prevention, I mean, I cannot re-emphasize it, but prevention is always better than cure, and we can pick up especially kidney diseases very early, and we have disease modifying treatment which would prevent you to go to the stage of renal failure.
So empowering yourself with that information. Thank you so, so much. Really appreciate your time. And if anyone is, of course, looking to investigate or needs some specialist treatment, you can find Dr. Krishnam Raju, consultant nephrologist at Prime Health. Thank you so, so much for tuning in to Eye on Health here on Dubai Eye 103.8, brought to you by Arab Health and MedLab Middle East. Make sure you do join us next week for more in-depth conversations on all things health from industry insiders, the best in the business, and wishing you a very happy and healthy day ahead.
You're listening to Eye on Health on Dubai Eye 103.8.
With MedLab Middle East. Register for free until the 7th of January at medlabme.com.